So, can you hear me? But more importantly, can you understand me? I'm not from Canada, so there's a wee tip. And I tried to call Shirley earlier today, and there's a voice recognition telephone system, and I tried about 3 times. I said, Shirley Fenton. I thought that was fairly clear, and it came back and said, do you want Ralph Lawrence? So I said, no. And what was worse, it didn't even understand my no. So I have no idea if you understand what I'm saying today, but that's fine. I'm really happy to be here, and I'm really pleased to see so many of our partners out there and even potential competitors, because I know we must be doing a good thing if you're all coming to listen to what I'm saying, or you may even be interested in partnering with us, which is always good as well. So thanks. What I'm going to show you in the next 40 minutes, assuming we have time, is the portal product, and I'm actually going to get straight into it now, and there'll be time for questions at the end. We're also passing around the room right now, I think, a tablet, which is sitting about there halfway, and so if you can't understand me at all, just feel free to play around on the tablet. At least you'll have had a fun day. So if you just bear with me now, I can at least spell. No, I can't.
You can spell differently.
I've been getting this hard time all day, by the way. I'm just logging in, and I'm logging in as a user, a physician, and this is a typical sort of family physician view. As I logged in, I just typed in a user ID and password. We also support biometric mouse or swipe codes. Some of our sites, they're busy ER physicians, and they don't have time to type, just like I did there. So we can support a number of ways of logging in. So what we've got here in front of us, and I do have the pointer, but I probably don't know how to drive it, so shall I attempt it?
Press right on the top.
I think I'll leave the pointer. What we have presented in front of you there is a common clinician homepage. Now these pages can be configured for a user, and it depends on what your type of speciality is in a health organisation as to what information you might want to see. And for this particular physician, they have their Outlook or their calendar and inbox there. They may decide, well, actually I don't really need my calendar because I've got all that in my PDA. So perhaps I want to have the ability to do a patient search or look at my recent patients. Anything like that can be configured simply by themselves in this way. So we're just going to change that particular user, and it's as simple as that in terms of configuring. Now, each of these little panels here we call windowlets or portlets, and all of those again are configured, and it depends on what information you want to display based on what your role is in the organisation. We have here pushed out to this particular physician his recent patients, and they may be the ones he was attending to in the last week or day or 24 hours. And at this point I'm going to select a particular patient here. He's called Mr. Graham Lang. He's actually from Alberta. We've met this guy before. And as I select his name, he appears, his details appear up here in what we call patient context. And now, wherever I move in the portal environment, I will be finding information pertaining to Graham Lang. So I can look at his clinical documents, I can look at maybe his pharmaceutical information history, which is up there. We may want to place some orders relating to Graham Lang, place some pharmacy orders or put them on a specific program, or we could just look quickly at what past medications he's been on. So here we have also on the left a summary history of information available. Again, this particular area is called a patient dynamic summary, and these windowlets can be configured depending on what your role is. And we've presented a fairly typical primary care physician display of patient summary information. So it would be their consent and their demographics. As we work our way through here, we've got their alerts, any particular problems. Graham actually has got some, but we don't know about them here. We've got his encounters, his procedures if he's had any, and in some of our installations we've even gone right out into the community and looked at information sitting in community centres like social services and so forth. So that's the patient dynamic summary. Those views can be tailored to what your role is. So an ER physician may have a completely different set of information there about Graham Lang. These particular areas, if you click on there, it's all quite easy to use. You can see what pops out is a drop-down of various items here. I'm just going to walk through some of these items just to show you the flavour of what information can be presented about Graham. So you see we've got a letter back to the GP after he's seen the diabetologist. This is a Word document, and these documents all exist now today in many repositories in hospital systems. All we're doing is retrieving existing information. We've got similarly some dietitian note here. We have a funding request, and this is actually a scanned document. We have the ability to catch existing paper documents or maybe some scribbles that a physician has made and also pull that in to become part of Graham Lang's record. We've got another one down here which was a GP referral, and this was a handwritten referral. Some people still haven't got away from that. In time, I'm sure these particular forms will become electronic, and we'll also capture those here in our portal. And this example here that I'm about to click on, if you see here there's a little lock on it, that's an example of a private patient document. So there's some sensitivity around that. For this particular user, he is allowed access to look at that, but there may be various levels of security around that document for other users. So perhaps as practice nurse, when she logged on, she may not even be able to see that document. She may not even be able to see that there is a document like that. So we can support all the levels of privacy and patient security that your organisations want to put in place. If we come down here, we'll be able to see some lab results, and you can already see the special alerts, the red flags that indicate there's abnormal data there. So at this point I'm actually going to log out and now log in again as an emergency physician, and for those who are looking at the tablet, you can also pass that round, and I'll share the passwords with you as well, if it happens to have logged out by now. It has. So you could log in as ED and Concerto. It's a good way to learn how to spell the name of our product. So now I've logged in as the Emerge physician, and this is a typical representation of a whiteboard in any normal hospital right around the world. You have the patients listed there, their triage category, so when they should be seen, and you can order this information by any of these panels here. So this is like a summary of existing whiteboards, and you can also configure this to be represent your wards or other departments as well. So if we click on this particular patient here, Bill Lewis, again, he becomes the part of context, and so wherever I move within the portal, I will be finding information for Bill. And Bill's got a few problems, as you can see there. And the type of information the ER physician is presented here is similar, a little bit similar to the physician, but there's less demographic information. So you can include within those windowlets any particular set of information that's important to you, depending on your role in the organisation. If we look here, we again see a summary of information. I'm just going to click on this particular lab result. We display all lab results, X-ray reports, and these reports come from the underlying system, or they could come from the clinical data repository like HTB. It entirely depends on how you want to implement Concerto. So we have here the full blood count for this particular patient. You can look and see who's actually seen this report at any point in time. And you can actually sign the report off here. You can say, right, I've actually seen this document, or you could write your signature if you wanted to there. And you can see I still can't spell. So if we now go to display this cumulatively, we might want to graph this result with his previous result. So perhaps he's had 2 or 3 blood tests in the last week, and we might want to see, well, hey, that one was slightly abnormal. Well, let's just check a couple of those parameters and display this graphically. So just while that builds a wee picture here, well, we can even configure that so we just look at the most recent one, recent result first. And that's just updating. Bear in mind that this little laptop here is running the equivalent of a hospital within a VMware. So its performance is pretty good, I think. So that's looking at graphed results, and you can graph any of the parameters of the data that are there. We have, again, X-ray reports, and we even have a link. This is quite a key feature of the portal overlay. One of the problems with clinicians in the current environment is they often have to log in and out of different systems. So if we wanted to check that report with the actual image, they would have in the past had to log off and maybe log into another application somewhere else, or perhaps on the same workstation. They would have then had to find the patient, so they would have probably done 2 or 3 more steps, whereas this way we can actually go straight to the image and have a look at it. And you're even working right now, this is within the AG for Web 1000 application, we can even be moving that image around and looking at it just like you were in the AG for application. Again, I've shown you a ED physician login. They may want to check some patient that they have in intensive care at this point in time. This is an example of another application that we can interface to. Again, this is interfacing directly to that application in real time. I think that's Philip's Care View. So we have a number of other partner organisations where we've interfaced their application. I'm now just going to take you briefly through what we have, physician order entry application, and I'm being prompted, because this is probably the first time I've used this, to agree with the licensing here for that particular application. Well, it's not actually allowing me access to it. You just bear with me a minute here. This is when we... It didn't want to take me there. This is when we wing it, Kiwi style. I've let you know where I'm from. So I'm just going to log in again as another user who I know has access to this. And our physician order entry, basically this application fills the gap if you don't already have electronic order entry in your organisation. And with this application, you can configure it to meet the forms and the lab tests and the radiology x-rays your organisation can do. And we again have other panels that I'll show you very shortly that can be configured for allied service ordering. This is all clinical ordering rather than looking at procurement or loading up your pharmacy with drugs. So I'll have another attempt to get into this application, and I have full privileges here, so that's good news. Maybe the ER physician wasn't allowed it. This particular area, we basically present all the information in one screen, but you can enlarge each of these panels if you want to look at specific information. You can add alerts on the way if you found that they have problems and interactions with another drug. You can actually update that information here. We're showing on the left-hand side here all the historic orders that have been placed and actually where they are within the system. So maybe you've made an order for a pharmaceutical, but it might still be waiting to be dispensed by the pharmacy. Or perhaps the pharmacy system hasn't actually received it at this point in time. And you can even look at cancelled orders. So if I was a clinician here and I just wanted to reorder this drug that I ordered the other day, I'd simply click on here and I'd go, right, I just want to reorder his Voltaren at this point in time. And what I'm presented with is, I've just got to scroll down here, is a screen. And it's prompted me with an interaction here. He's already on a drug that potentially interacts with what I've given him. So I'm just going to continue at this point, let them know I've been aware, I'm going to adjust the dose and the fact that I've overridden it. So now, as I scroll up here again, you'll see that that order has been placed in the order basket. You'll see shortly I'm on a reduced real estate here, so you've just got to bear with me. We can even place laboratory orders here, and these can be reproduced to meet the forms that you already have in your own organisations. We can place X-ray orders here, and basically what this application does is it sits over the top and sends messages to the underlying systems and retrieves data from those systems to complete the order history and data there. So in our X-ray application we've made it fairly intuitive, so if it's 3 in the morning and you can't remember what that particular part of the anatomy is, you can still make those orders. And we have the angiography and MRI and so forth. So the last particular panel in our order set, this is the allied services, and again you can configure this to order an orderly, you could order translation services, probably what you need from me today, and we have just a range of things here, maybe dietary, a special diet need for a diabetic, for example. So when I actually finalise those orders that are in the shopping basket, it actually goes away and does a bit of checking for duplication. And again, I'm on a reduced real estate here, so, and my order's been placed successfully. So it's the blind leading the blind at the moment. So that order's been placed, and now you can see it's come up here at 9:28. Well, my time's not right. So that was order entry. At this point in time, we have another application that clinicians use. And this application was developed primarily because in New Zealand and Australia, primary care physicians had already got quite automated, and they had probably for 2 or 3 years been receiving their laboratory results and their radiology results electronically, and they'd virtually moved to partial electronic medical record, and they were exceedingly frustrated with their hospitals because they were still getting this wad of paper all the time, and yet they were using 2 different systems. So they prompted their hospitals to develop this, and the bonus was for the hospitals that they saved quite a lot of money in process and time, and it basically sped things up from a patient back to the GP point of view. So often the patient was going back to the GP and the primary care provider hadn't even received the discharge summary, or if they had, some of the information on it wasn't that legible. So this, in its progress forward, actually solved a number of other problems on the way. So I'll just show you a flavour. We can actually edit some of these discharge summaries. Again, we map these to fit your existing discharge summaries that you have in place today. So all the information on here can be configured, and you can even lay these screens out the way your own discharge summaries are. And what this form does is it actually populates from the underlying system. So a lot of the data in a discharge summary is actually already there, and it just needs to be pulled through. So we pull these through into a form. All the doctor has to do at this point is complete these panels here, basically, what is free text. And what's actually happened now is the organisations who are using this application have much more standardisation across their medical summaries or discharge summaries, and they've even extended this application and said, let's use this for our handover notes and for our inter-department notes as well. So they've taken it a lot further than we ever anticipated. So we have some various forms you can plug in. We have different varieties of templates here. Again, if we had a little bit more time, I could show you more of these. So probably one thing I haven't demonstrated, and I'll just create one on the fly. So as you saw, the information was populated just like that. Is that when you finish this, I'll just put something in here so we actually make one. And I'm going to finalise it. When you actually have completed these discharge summaries, I'm just trying to find it again. Oh, I can't find the right one. It actually gets sent to that particular provider electronically. So say they were hooked up with Purkinje or Oscar or one of their own clinical systems, they could be receiving that document right into their own clinical system, which would also save them a lot of time in looking for the data when they have the patient in front of them. So that was pretty much discharge summaries. Finally, what I was going to spend some time showing you or talking you through is our product called Soprano Integrated Clinical Workflow. And what this application has done is basically taken the information that we've had in all these other systems and enabled patients with chronic conditions or patients needing to be on care plans or even populations that are involved with screening, enable that information to be shared and transferred between the parties, and also the various tasks that have been completed by those providers can be made available to them. So it's basically integrated care from cradle to the grave and for chronic conditions. And given that it normally takes about an hour to demonstrate this product in its entirety, I'm only just going to cover very briefly. So we have here patient details. These are fairly standard in most organisations. This particular patient is actually enrolled on a couple of programs. And as I said, these could be screening, it might be hepatitis screening or breast screening that needs to be carried out. So you can enrol them on any specific programs. And typically these programs involve multiple parties, so it's always multidisciplinary care involved in some of these areas. So we have already configured programs for asthma, COPD and diabetes. But what we tend to find when we implement this application is we would never go in and say, this is what you need to do for diabetes. We would let our clinical people work with the clinical teams in that organisation, and invariably we find our clinicians meet all their clinicians and they have pathways that are very similar, and they already have these plans in place that they're actually working on, but they're in paper form. So they basically get together and get the various stakeholders together who are involved in the care of diabetes and pull the program together. So just looking at the diabetes one here, we can see here for this particular program we have 3 providers that are taking care of Graham. One's a dietitian, one's a GP and one's a diabetic nurse. Now they may be involved in just parts of the care of Graham for his diabetes. Maybe the GP's role is to check his medications or actually carry out a full check. Again, we have one for a hip plan here, and we have three other different providers that are actually registered to take care of that patient. Now, a lot of this information is probably not going to make much sense to you, but as I said before, in New Zealand and Australia, the GPs are already using systems, so the care of these patients and the transfer of tasks for these patients actually happens between the various systems. There's no way the GP who's already invested in their own system wants to come in and use somebody else's. So this is what this HMS mailbox actually means here. And I can explain a little bit more about that later. When you become registered on a program or an integrated care plan, part of that involves tasks. So we have here, Graham Lang has previously had some of his annual and quarterly diabetes checks. You might just want to have a quick look here as to what were those checks. And these will be very similar to what your organisation's already involved with. So you'll be having providers out there who are already collecting this information now. And what this system does do is it pulls together the providers and the information, and it's very patient-centric. So it actually captures the information that everybody's already collecting about the patients. So if we just go back to the full task list, what this also does is it basically applies rules on the data that's collected. So if you want to get patients who are slipping through the cracks or the gaps, you need to make sure you have some rules in place where you perhaps bring in further checks. And this is just a sample of the types of rules that are applied to the data that we're collecting on the fly. So if a patient has a high-risk foot and his diastolic blood pressure is greater than 85, then another task is generated. So this has intuitive rules engine behind the scene, and he's he's been reminded, or the provider's been reminded, to go and check his blood pressure. So I'm just going to now show you, this is a future task. This is the type of form that would be completed if the primary care provider or the person involved in this care of this patient did not have their own system. So it's a fairly straightforward form, and they could be capturing a lot of this information and just filling it in. You can see intuitively which are the fields that are compulsory, and the whole idea behind this is to try and make it as simple as possible and also fit in with the workflow, so how they would typically normally assess patients with diabetes. So on the completion of that form, this data is stored in a repository centrally, and it's updated and refreshed when any other person involved in the care of that patient also completes similar information. So you're getting sort of real-time update from people, even if they're not even geographically close to each other. So finally, as a result of collecting all that information, you have the ability to look back at previous data. So I'm just going to look briefly at his blood pressure checks just to see some trends here. And you'll see over time, you can quickly look and see with his annual and quarterly checks, his blood pressure's gone up a little bit. It's gone down, and now it's started to come up again. And at this point in time, there might be some blood pressure recommendations made. Or maybe if you want to apply a certain rule, perhaps he needs to go back to see the specialist. So that's pretty much a 5-minute view of disease management, and I hope by now the tablet's found its way around the room, and people have also figured out how to use the applications. If I haven't shown you a good enough job, and I'll just hand back to Trevor at this point in time and look forward to your questions shortly.